know anyone that has skin cancer? Chances are you probably do. I can name about 5 people that I'm close to that have cancer. Skin cancer is one of the more talked about or common forms of cancer, and I'm here to talk a little more and explain a little bit more in depth of skin cancer to you. And it is the uncontrolled growth of abnormal skin cells in the body, and there are many different kinds: small, shiny, waxy, scaly, rough, firm and red, crusty or bleeding, or other forms. This is mostly what comes up on your skin. If suspicious moles or sores or skin growths, anything like that pops up on your skin, you should definitely go and get it checked out. There's 3 different kinds of skin cancer according to medicinenet.com. The first one, in order from the least threatening to the most threatening, is basal cell carcinoma, and it is the most common, accounting for 90% of all skin cancer patients. This normally comes about in fair-skinned people. The risk factors are exposure to sunlight, age, exposure to UV rays, and therapeutic radiation, which is actually a treatment for other forms of cancer. Another one is squamous cell carcinoma, and it is when cells form at the surface of the skin or on the lining of hollow organs. Melanoma is the most threatening form of skin cancer, and it is when melanocytes become malignant, and it usually spreads to the lymph nodes, and when it does, it can spread to other organs such as the liver, lungs, and brain, and once it does that, it's pretty much uncontrollable. Most treatment for skin cancer involves just removing of sores on the body, and it can be done by excision, curettage, electrodesiccation, cryosurgery, or radiation. And all this involves freezing, using electricity, cutting or scraping away at bad cells on the skin. Actually, some of it could be so small that it could be fixed with skin cream that has been prescribed by doctors. My grandmother actually had skin cancer about 2 years ago, and she was with her youngest daughter taking her grandkids to the pediatrician, and he looked over and saw a couple spots on her wrist and told her she needed to go and get it checked out. And she did, and her family doctor told her to go to a specialist. Well, she went to a specialist, and he told her that she definitely had skin cancer and that she would have to come in for treatment. Well, when she come in, they told her to hold her arm above her head and look the other way. They didn't even put her asleep, and they burned the spots off of her wrist. She's lucky to not have it come back up, but this was 2 years ago. It's difficult to look at all the things that make life so hard, especially when it comes to the ones that you care for so much. And I hope you can understand that cancer isn't something to be joked about or toyed with or looked over. Also, I hope that you know that what to look for when you think that you might have something pop up on your skin or on your loved ones. I used to practically live in the tanning bed until I started research for this speech, and it's truly touched my life to hear my grandmother speak about something that's so horrifying. I hope you got as much out of this speech as I did. Thank you.